Honorable Minister of State for Health and Family Welfare, Shri Ashwini Choubey ji, Honorable Deputy Prime Minister Nepal, Shri Upendra Yadav ji, Honorable Health Minister Ukraine, Dr. UlanaSuprun, Honorable Minister Bangladesh, Mr. Zahid Maleque, Honorable Health Minister Maldives, Dr. Shah Mahir, Honorable Health Minister Sri Lanka, Mr. FaizalCassim, Honorable Minister from Botswana, Mr. Bigi Butale, Dr. Poonam Khetrapal Singh, and both our secretaries from Health and IT. Ladies and gentlemen, on behalf of the Ministry of Health and Family Welfare, Government of India, I would like to thank all our honorable ministers who joined us today, our distinguished guests and panelists for participating in this 4th Global Digital Health Partnership Summit. As this Global Digital Health Partnership draws to a close, we can say with confidence that it has fulfilled and even surpassed many of the expectations we had when preparing for it. With so many conflicting demands on your time, your presence here is a testament to your passion and commitment to the digitally enabled, healthier world. Healthcare landscape is ever-changing, keeping in mind the rising incidence of chronic diseases and healthcare requirements. Both the healthcare providers and the communities need to make significant amendments in their approach. And technology provides us with various modalities to reach out to our citizens and enable quality care. Digital healthcare systems can be used to better track the disease patterns and can be effectively used for disease surveillance and monitoring the outbreaks. Digital health records, coupled with clinical decision support system, will also make sure that correct decisions are made by leveraging technology. Digital health will also create a lot of data, and all that can be then analyzed to create better health interventions and also better health policies. Expert systems are a must in a country like India. We can have a clinical decision support systems for our health workers and at our primary healthcare facilities, which will help in doing better diagnosis and also will help in reducing disparities in treatment. While we work to improve our doctor-patient ratio, technology can always fill in the gap and make a specialist available via telemedicine, which will help in treating the beneficiary. Through the engagements we've had over the last 2 days, we've been able to identify the challenges and develop solutions to improve the digital health ecosystem across the world. This partnership, ladies and gentlemen, is not only for supporting governments, but for reforming the healthcare system in order to improve the health and well-being of all our citizens through the best use of evidence-based digital technologies. The countries around the world are making significant efforts in programs to modernize the health service delivery. They face common policy and delivery-related concerns and challenges in realizing the full benefits of digital health services and high-quality information sharing. We should also keep in mind that technology is not the panacea for healthcare, but it is a part of the solution. As we are seeing and experiencing, digital health is empowering us to better track, manage, and improve our own and our family's health, live better, more productive lives, and improve the society. It's also helping to reduce the inefficiencies in the healthcare delivery systems, improve access, reduce costs, and increase the quality and make medicine more personalized and precise. Providing healthcare for all, especially in a country like India, is a humongous task. However, the current government is committed to provide not only affordable, accessible, and available healthcare, but also making sure that healthcare provided is complete, continuous, and comprehensive. The 2 critical points I would like to highlight are the lessons that the ministerial conclave taught us in terms of operationalizing the digital healthcare at national and subnational levels requires thoughtful planning, appropriate policies, an effective financial mechanism and governance. And the second is the adoption of the Delhi Declaration, which shows the collective endorsement and consensus on the role of digital health in achieving universal health coverage and sustainable development. To conclude, let me thank once again the participants, the moderators, the chair, the panelists, members, and other guests. The partnerships among multiple countries with different core competencies are essential, and no player can make a big impact alone. Cooperation and partnerships are vital for the adoption and usage of digital health services and can dramatically reduce costs to the government and burden of the diseases. I also want to say a warm thanks to the co-organizers, our colleagues from the World Health Organization, the Australian Digital Health Agency, and all our colleagues and partners. Let us keep the dialogue going. Thank you very much.
Thank you, ma'am, for your views, and thank you for expressing the way forward and the approach as India sees towards digital health.